All right. Well, good morning, everyone. It's 9:02. We'll get started here. Happy Monday. It is June 5th, 2023. I appreciate everyone for being on the call today live. I'm calling from Boston, Massachusetts today on a business trip, but I appreciate everybody being here on the call. And we are here to improve the lives of our community with affordable healthcare. So thank you for being a part of that mission. And thank you for waking up early with me. We have some special guests from United Healthcare today, and Jesse, and I see Susan's on there too. Thank you guys for being on the call. We're going to pass them the mic in a few minutes. And so we've got some updates from United Healthcare, specifically a brand new plan that's exclusive, an exclusive plan from United Healthcare. I don't even think these girls know yet. I'm going to share with them what Health Plan Markets has for United Healthcare. Very, very exciting stuff here this morning. But that involves some training. So I want to make sure that everybody knows that we've got some training coming up. So let's jump over to the training calendar. Remember, we always have to have one foot in the classroom and the other one in the field at all times. And so training. The first thing is today at 11, there is a link to the new features from Spark. They recently rolled out on your CRM. If those of you that were using the CRM Thursday, Friday of last week, or maybe even over the weekend, you've noticed that both on the mobile app and also on the computer version of your CRM system, of your Spark platform, that there's been quite a few changes. What's going on is they are building a lead management system inside your platform now. So you're going to see a sales pipeline that involves taking a prospect from lead to client. Very, very exciting. It is a lot more moving pieces, so I highly recommend that you click on there. We've got some webinar signups. There's a video walkthrough, and we're going to be sending out the links to the recorded version of the webinar as well, so you can kind of watch it and understand all the changes that are happening inside the platform. But feel free to go in there and mess around with it. You won't break anything, I promise. But there are some notes in there. At 11 o'clock, you can see all the links that are there. Thank you to Tom and Al for putting that together. Later today at noon, in Orlando, Humana and Care Plus is doing a benefit plan review, so you can check that out there. Learn more about that if you need it. Also, 3 o'clock today, Humana is doing their new Achieve Medicare Supplement Plan training. So if you need some sup training, that's on the calendar as well. Also today at 4:30, United Healthcare is doing a chronic needs plan training. So that is there. CSNPs are very important for several reasons. Number one, there are so many folks that have 2 or more chronic conditions that these plans are specifically designed for, specifically like diabetes, chronic heart failure, things like that you have to pay attention to for your clients. But it also opens up a special election period for your members that they can make a change once a year. So, we're past OEP. The hurricane is coming to a close. Finally, some carriers are allowing that to be extended. However, once that is over, you're going to need to get creative. So CSNPs are really important for allowing your members to make a change throughout the year if they're unhappy with their plan, allows you to grow your book of business, and really to service members by their medical condition versus just putting them in a one-size-fits-all plan. So please spend time on these trainings, especially CSNPs. You get really good at CSNPs. You can identify a CSNP member just by seeing what medications they're on. So that's a training that you can check out. Moving over to Tuesday the 6th, that's tomorrow, Cigna's hosting their Medicare Advantage Vision and Hearing Benefit Overview. That's at 9 o'clock tomorrow morning. Also, they're doing office hours again. Looks like they're doing it on Tuesday at 11, Wednesday at 12:30, and Thursday at 11, in case you need to get a hold of Cigna. They're available. They've got their office hours there. Also tomorrow, Tuesday at 2 o'clock, Humana is doing their Ascend training, although we use SHOP, so no need to attend that one. But if you are doing business in the Florida Panhandle or the Nature Coast up there in that area, you're going to want to attend that training benefit review. Moving over to Wednesday, Ask Al is back, 9:30 on Wednesday. Virtual coffee and chat with Al. Bring any questions, comments, rude remarks regarding HPM, anything that you need. We want to be there for you. This is a great opportunity for you to get in front of the Wizard of Oz there. If you have any questions, if you're lost, if you just need some advice, if you're worried about marketing, if you're, need to talk about benefits, anything at all, Al is there to help you. You can join there with the link at 9:30. And then also, we already talked about the virtual training and Ascend there. Moving over to Thursday, Humana is doing a Care Plus required app script. So this is being hosted by Tom, I believe. And what's happening now is the carriers are basically saying, if you are doing an app online or over the phone, you really need to have a script. So Humana is the first company that's coming out and saying, hey, you need to have a script when you're dealing with somebody over the phone and helping them enroll. So we're creating a health plan markets version of that. So stay tuned for more, because we believe that this is going to become a trend on following a script during the sales process. Now Humana is requiring this to have happen. So it makes it a little bit harder to do business, but it is what it is. Also on Thursday, there's a DSNP training as well from them. And then moving over to 2 o'clock, you've got another Ask Al live session. He's doing it live, not on camera, at Cimarron Boulevard, 6424 Cimarron Boulevard, in case you want to get in front of Al on Thursday at 2 o'clock. But there also is veteran training there. That's a virtual training on Thursday at 2 o'clock. Getting a lot of questions about that specifically. And then moving over to Friday, 10 o'clock, there's that telephone script again. We've got another session there that we'll go through. And then last but not least, on Friday, United Healthcare is doing their virtual office hours from 3 to 5. So if you have any questions or if you need help specifically, great opportunity for you to meet your local salespeople. So there you go. There you have it. That's the training for the week. Just remember, guys, 1 foot in the classroom and the other one in the field at all times. I do want to share with you guys, we're going to talk about United today because we have our guests here from United Healthcare. And we have been invited to participate in an exclusive plan from United Healthcare. Some of you have already received invitations. Some of you will receive an invitation to take an additional training. I know, another training. But this is for an assisted living plan. Yes, it's called an iSNP. Okay, so Health Plan Markets has been selected as one of the few agencies that will be able to sell an institutional special needs plan. Okay, this is across the country, depending on where the areas are. I know for sure Florida is going to be one of the first states that this iSNP is going to be available. So an assisted living facility plan basically allows you to enroll somebody that's living in one of these facilities into a Medicare Advantage plan that acts and feels like a DSNP, but it's specifically designed for institutional care. So United Healthcare is one of the first companies that's going to allow brokers to sell this product, but they're not opening it up to everyone. So just because you're with HPM, you will be one of the first agents in the country to offer this iSNP plan. So if you're already contracted with United Healthcare, there's nothing else you need to do. Just check your email. You should have gotten an invitation, or you can go into your Jarvis portal and there should be an additional training in the learning section there for this iSNP plan, okay? I'm not gonna spend a lot of time going through it this morning because there's an entire training on this, but you will see that there are some amazing benefits from transportation, hearing, dental, and vision that doesn't exist anywhere else. But this is specifically for folks that are living in a assisted living environment, okay? So check that out. The training you'll see is tomorrow at 2 o'clock. So you'll get that email if you're already contracted with United Healthcare. That training is at 2 o'clock tomorrow. And I will pop that in the chat for everybody to see it, just in case you have any questions on that. We'll make sure that you get that going. So I'll pop that into the chat as well. One thing before I hand it over to United, I do want to share with you guys a couple of links. So there's the first one is for the Google review, which I'm going to talk about in just a minute. But this training specifically, you're going to see from Optum. That's for the United Healthcare iSNP product. Okay, but I did also send in a link about our Google review page, and I'm running a contest. And I want to go through this with you today because I don't have a lot of opportunities to do this, but I'm here to confess that I messed up. And what I did is when we opened up our Google account for our downtown Orlando office, I believe it's my fault. I accidentally deleted our old profile at West Colonial, including all the nice reviews that we had from before. And so I'd like to ask for your help. I'd like to build those reviews back up. So what I'm asking is if you leave a review on our Health Plan Markets page, some of you have already taken advantage of that. So thank you for doing that. Leave an honest review on our Google review page, and make sure that you mention your favorite team member about your experience at Health Plan Markets. Now, if you make a video testimonial, you'll get a bonus, and I'm going to share that with you in just a minute. But just for leaving a review, I'm going to give you a $100 voucher for restaurants. So if you remember us as kids, we would go around and sell those coupon books where you would get 50% off or buy one, get one, or 10 bucks off of here or 25 bucks off of there. So these restaurant vouchers is worth $100. And I'm going to give you one of those coupon books. It's a digital coupon book. Just for leaving a review, I will send that over to you by email. For each review, I give you one $100 certificate in those restaurant vouchers, and it will be sent to you within 10 business days. It'll come by email, so just check your email on that. So all you got to do is leave a review. Now, in addition to that, every review will be entered into a contest to win a free vacation. Yes, I'm not joking. This is real. If you leave a review, an honest review, not only do you get $100 in restaurant vouchers, but you also get entered into a chance to win a vacation. There's only one review per agent, please, and each review enters you into the contest. So you leave a review, you get one entry. Now, remember that video testimonial, that bonus? If you leave a video testimonial for Health Plan Markets, I will give you a second entry into that vacation contest. So you receive an additional entry for creating a video testimonial as well as leaving a Google review. So one for the video, one for the Google review. You get two entries, so you double your chances of winning that vacation. And it's anywhere in the United States. We've got awesome locations for you to pick from. I am going to send out a video on this so you guys can see, where you can actually go. But it's very simple. So the link is in the chat there. So go ahead and click that link, or you can go to Google Health Plan Markets. You'll be able to find us there and leave us a review. The deadline to enter the contest is June 29th, and we will draw live on camera June 30th. We're going to do a spin the wheel contest, and we will have one person selected to go on the vacation. Now, here's the cool part. Remember, we need you to mention your favorite HPM team member, because the teammate with the most mentions will also get a vacation as well. You don't have to take them with you. This is a separate contest for them internally, just because we want to promote good behavior. So that's the contest. I'm going to send some more details out later on down the road, but that's where it is. So the link is in the chat. All you got to do is leave an honest review there, and you get a double entry if you shoot a video testimonial. So very excited to see your guys' reviews on that. So thank you very much. With that, I'd like to pass it over to Jesse or Susan Hartman, whichever is clever as far as who wants to go first or together. And thank you guys very much for joining us this morning. Can you hear us okay?
I sure can. Justin, can you hear me?
Yes, perfect. Thank you very much.
Awesome. Well, thank you so much for having us. Good morning, everyone. Happy Monday. Let me go ahead and share my screen.
You got it.
And if you can just confirm that you're looking at my screen there.
We got it. Yep. Experience the difference.
All righty. Well, good morning again, everyone, and thank you for having Susan and I on today's call. Hopefully, what the information that we're sharing you find valuable. And after the presentation, I'll be sharing our contact information. So if you have any specific questions, just feel free to reach out to us, and we can connect and share all sorts of good information. So I'm just going to dive right into the information here. And I just wanted to talk to you a little bit about what sets United Healthcare apart. So, United Healthcare has a nationally recognized brand, and it offers a national footprint of the Medicare products, including Medicare Advantage, Medicare supplements, and our standalone Part D plans. And we are proud to be the industry leader in the market for both MA and Med Sups. And we're the only carrier to offer plans with the AARP name. So that's important to know, because actually, when we got information back, the number 1 and 2 most searched insurance companies are AARP and United Healthcare. So it's nice to know that we have that exclusive relationship. Also, more people choose United Healthcare's Medicare plans than any other company, and there's a reason for that. So we take care of our members, and we're very proud of that. Also, we have the backing of a Fortune 5 company, and we are the only carrier that offers MA, PDP, and Medicare supplement plans that carry that AARP brand name. We've also been recognized by Fortune as one of the most admired companies for the 12th consecutive year. So you may be asking yourself, well, Yesy, what does this all mean for me? So it just means that when you put your members with United Healthcare,
Well, I really can't hear.
oh, sorry about
watching.
that. Someone is unmuted. There you go. Okay, so what it all means for you as an agent is that when you put your members with United Healthcare, you can feel confident that they'll be backed by a company that'll take care of them. So it's more than just the benefits, it's really just the entire package. Now, jumping into the agent experience and what we've done for our agents. Oh, it says that you're sharing a window, maybe, Justin? Not letting me proceed. Are you still seeing the UHC differentiation slide?
Yep, I'm still seeing that. Yep.
Oh, there we go. Sorry about that, a little bit of a glitch. Okay, so as an agent, now I'm not sure if everyone is aware, but I'll just share some information that's available to you. You all get the $75 health assessment credit for completing that survey on all of our products. And this also applies to plan changes. Now, I know that HPM uses Connecture, so Connecture was added for 2023. And this is something that you can take advantage of through the Connecture system as well. Another change that we made for this year for you as an agent is that you can request a new ID card for your members through the Jarvis platform, and you can also change their primary care physician on there as well. If you happen to be using our lean system, then there's also a certification check in there that'll let you know if you're completing an application for a plan that you're not certified in. And another change that we made is for our producer help desk, we increased the staffing to make sure that we are available to answer all of your questions. And if you're an agent that has sold 3 or more applications, a new agent, then we've enrolled you in the new agent success program, and they will be sending you emails letting you know how you can take advantage of that program to help you really develop yourself and really be successful as you start this new journey. Also, for our agents that are premier agents, that means that you're silver, gold, or platinum, there is priority queuing through our chat as well as through the phone. So when you contact the producer help desk, it'll route you through that priority queue. And then agent materials. So just like last year, our materials will be available on the toolkit on October 1st for you to be able to go in there and order all sorts of personalized materials. And one thing I wanted to just kind of plug in here is our certifications are available starting June 12th. If you go into our knowledge center already, the study guide is available for you to be able to review the information. But just make sure that you try and get those certifications completed as soon as possible. And the reason for that is because that it'll open you up to be able to order the materials early and receive them before the start of AEP. So that way you don't have to kind of rush at the last minute. You can make sure that everything is available to you early. One thing that we did for this year is that the enrollment kits now have the service area back on the front, which it will tell you what counties the consumer has to live in order to be enrolled into that plan. So it's something they had taken away last year, but they did bring it back because we took all your feedback into account. And lastly, just talking about that learning lab, aside from the certifications being in there, there's also live and self-guided trainings that are available. So just make sure you go in there and register. Not only are they United Healthcare specific trainings, but there's things in there to help you to develop your business plan. They talk about LIS. So it's really things that as agents that represent multiple carriers, you can apply across all those different carriers. We really want to help you and help your development. And there's even a class in there on how to grow your book of business. So definitely go in there and check on that stuff. Okay, so talking a little bit more specifically about the benefits, and I know that there's a lot of agents on the call with us today that not only sell here in Central Florida, which is the market that Susan and I represent. So I'll try and keep it a little general. And if you have more specific questions, then absolutely reach out to us. But some of the positive changes that we had for this year, as you can see, is all these zeros on the screen, is all the $0 cost that we invested into. So 94% of our dual members have $0 for all covered drugs. We're aware that they have low income subsidy, and once they go pick up their medications, there's usually a cost associated depending on what level of extra help they have. However, on our dual plans, they have $0 across all their medications. We're really trying to reduce the cost for these folks. So that's a big, big deal for them. Also, for those members that are not on our dual plans, we've eliminated the prescription deductibles on all of our plans here in Central Florida. Pretty sure in the other markets as well, but you may want to check, but it's $0 across all of these plans for the deductibles. Now, for the tier 1 medications at a retail pharmacy, they'll still have a $0 copay for those tier 1 meds. If they happen to have a copay for tier 1 or 2 medications, if they decide to use our home delivery service, which is through Optum RX, then that's also a $0 copay. So it reduces the cost even more so. And 100% of our members that are not dual will have tier 1 medication coverage through the coverage gap. In total for this year, United not only down-tiered 26 medications, but they added 4 new medications in the tier 1 category. Specifically for our chronic members, they'll have access to 8 prescription drugs that are on a lower tier, mostly tier 1, to help them manage those chronic conditions. So we have more drugs on tier 1 than ever before, and we're the carrier with the most medications on tier 1. So definitely trying to reduce the cost for these folks. One more thing that I'll add here as far as meds go is that what we did is we've added a 100-day supply versus the common 90-day supply, which essentially gives the members a 30-day supply of their drugs after 3 fills. So what that does is that it just gives them an additional supply. So if they're going on vacation or if they lose some prescriptions, then they have access to some extra supply that they get to play with. And then, of course, we'll continue to participate in the $35 copay for the covered insulin through the donut hole as well. And if you join the training this afternoon with Susan for chronics, then you'll find out all sorts of good information about that chronic plan. But one thing I'll point out is that on our chronic plan, the insulin is $25 instead of the standard $35. So all good stuff there. Another thing that we have for this year, and it's been quite popular, is our U card. The U card is available on over 800 of our plans, and that means that over 6.3 million members have it. So this is the only card that they will ever get from United Healthcare. They could use it at the pharmacy, the dentist, for their vision benefits, their OTC. If they're on our Jewel plan, they'll also use it at Walmart, the Walmart Money Center, to redeem their utility credit. They would use it at the gym. So they're never going to receive a separate card from United Healthcare or any sort of reward card. We're really trying to lessen the confusion for them and make it very convenient by providing this card to them. So very, very good feedback on this card this year. And then another thing that we've done, and this is kind of related to the U card as well, is that when they go redeem these OTC benefits or the healthy food benefit, they can do that at over 55,000 stores nationwide. This year we did add Dollar General and Publix. So all good stuff there. And just kind of one thing to point out, not only with our OTC benefit and the healthy food credit, but the same thing with like our gym benefit and all that. Our network is nationwide. So they don't have to be local to use these benefits. If they're traveling, they can use the benefits as well. Another great change that we have this year is that we simplified our dental plan. In the past, we had these confusing 5 levels of coverage. We've moved everything over to one enhanced dental coverage level. So what this means is, depending on the plan that you're looking at, the members are now given a credit. And with that credit, they can use that to redeem their benefits however they see fit. So things like implants that maybe were not necessarily covered in the past, or dentures, are now covered under that credit. Just once they exhaust that credit, then they would come out of pocket for the difference. So just an example, if the services are $2,000, but then the credit is $1,500, then they would come out of pocket $500 for that difference. But they really have, it's nice to know that they have the flexibility to choose what benefits they want with that credit, instead of being restricted to a certain number of let's say fillings or crowns or whatever the case may be. Now, one thing I will say with this is sometimes it's a little confusing for folks, but our dental benefits, no matter whether the plan is an HMO or PPO, the dental benefits are always a PPO. So they can go both in and out of network. We always recommend that they stay in the network, because what this does is that it obviously their credit goes further, because they're seeing these doctors at these negotiated rates versus going out of network, where they're exposing themselves to balance billing and their credit won't go as far. But definitely they have the option to choose, which is nice. One thing with this credit that they get, the things that are not covered, as you can see here, are cosmetic services like whitening, bleaching, and veneers, orthodontics, missed appointment fees, and any sales tax. But with that credit, they do have the option to choose what they want. And then just another thing that we wanted to touch on, which is huge with United Healthcare, is really with our plans, is the access to care that they have. It's not only the fact that, in the state of Florida, they have access from the Panhandle to the Florida Keys to see providers in the state. But if they travel outside of the state, they don't need a referral, and they have access to over 1 million providers that they can access without needing any referrals, without activating the passport. For some of you that may have been around for a while, you may remember that they used to have to call customer service and activate the passport, and it was just a tedious task for them. So now they can just find an in-network provider wherever they're traveling to and schedule an appointment and see them without having to worry about any referrals. As a matter of fact, our plans here in Central Florida, they don't need referrals unless it's the chronic plan. The chronic only requires referrals in the state of Florida, but same thing here. If they're part of that national network, they can travel all throughout the country without a referral and see doctors. The plans also offer $0 worldwide coverage. I know we got a lot of questions about that. So that does work on a reimbursement basis. They would have to pay for the services out of their pocket and then just keep the receipts and an itemized statement of what they paid and then submit for reimbursement. And United Healthcare is pretty fast about that. So it's not going to take a very long time. And then they also have that emergency coverage and virtual as well. So we try and make sure that they're covered and that they have access to care no matter where they are or where they travel to. Just kind of talking a little bit more about the U card. This is what it looks like front and back. The reason why there's two pictures of the front of this is because the picture at the top is usually for our regular Medicare Advantage plans. And the picture at the bottom is for our D-SNP plans. And if you can see, the difference there is that the D-SNP one has the Medicaid number on the card. And then on the back, it does look the same. Just a couple things that I'll point out here is that if you look at the top right-hand corner, it will have the date where the card was printed and the plan year. I know a lot of times they get scared to throw away their card, but this will help them identify what the current card is and get rid of the other ones. And then if their plan has that national network that we talked about, it will have this symbol on there, the map of the United States, indicating that this is part of the Medicare National Network. And then, of course, the barcode at the bottom is what they would use to redeem their OTC or their healthy foods or utilities as well. If they go, they're on a D-SNP plan and they go redeem those utilities. So another thing I just kind of wanted to touch on that really I don't have a slide dedicated to it, but remember with our vision benefits for United, that's something I'd like to point out just because I know that representing so many plans, I don't know how you guys do it and keep all this information straight. So I admire you for that. But one thing is that when you compare these plans side by side, sometimes you'll see that, let's say United Healthcare offers a $200 credit versus another company might offer $300. And on paper, it may look like the $300 is more, but it's important to know what that credit really covers. So with United, one thing we do is that credit is going towards their frames and it's giving them more money to choose either nicer frames or something else that they want to add to them because the lenses are already covered through the medical plan versus maybe with the other company and those $300, then they're having to pay for the lenses and the frames and maybe have to come out of pocket to pay for that difference. So the standard lenses, bifocals, trifocals, and standard progressives, those are all covered under United Healthcare's medical portion of the plan and really just gives them more credit for their frames. So that is all the information that I had for you guys today, but here's my contact information as well as Susan's. Depending on the market that you're servicing, if it's outside of Orange, Osceola, or Seminole, we would love to get you in touch with your local market manager. But if you have any questions about these particular counties, then absolutely, we are your girls and we're here to answer any questions that you may have.
Outstanding job, Jesse. Thank you very much.
Oh, you're so welcome. Thank you for having us.
Yeah, there's a couple questions. I've got one, and then Eva's got one. But guys, just really quick as an overview, the number one Medicare Advantage plan in the country. There's no debating that. It's just reality. Number one in Florida. And I heard you say 1 million doctors in network. That's insanity.
Yep,
So,
over 1 million doctors nationwide. So I mean, they definitely have coverage wherever they go.
right. So, and the fact that you guys have kind of done away with the passport and made it somewhat of an open access network, for most folks, even outside of their service area, is just phenomenal. I mean, especially for those people that travel, 2, 3, 4 times a year, they're concerned about their health. They want to be able to access doctors. It's a huge benefit. So kudos on that. Eva is asking, is there a limit for out of the country service? Because I know you were mentioning in country. So she says out of country, no amount limit for medical care. Is there a limit for worldwide coverage?
No, there's no limit. Like I mentioned, the only thing that they would have to do is keep a copy of the receipt for the services paid, as well as that itemized statement. The only thing I will add to that is if they are in a country where they get like the documentation in a language other than English, they may need to translate it, but that's it.
Mhm.
So they just have to submit reimbursement, and they can do that by contacting customer service, and they'll tell them where to send all the information. And that's it. They'll get started on that reimbursement process, which I've heard is pretty pain-free and quick. So that's nice to hear.
Awesome. And I'm sure PhD at UHC can help out too if you guys get jammed up. But you've got
Correct.
Susan and Jesse's contact information on the screen now. Make sure you jot that down and put those in your phone as your lifeline for United. So fantastic. There's a question here. Are all plans available on Shop? To my knowledge, yes, all the plans from United Healthcare are available on Shop. I have also been told that the iSNP, the new iSNP plan, should be loaded as well. So those of you that are going to plan, that will be loaded into Shop. And this also includes the HRA form, which was a big reason why some of you guys were continuing to use Lean. And we love Lean, but the problem is we don't have eyes on that, so we can't help you with your application issues or anything like that. So that's why we prefer Shop. We can see everything within 24 hours, and we're able to kind of share with Jesse and Susan that, hey, this is where we're at, for the month as of yesterday. So it just increases the communication and visibility on what everything's doing there. Eva is leaving feedback. She would like more Spanish-speaking reps in the customer service department. She said there used to be up to 50,000 in the past. So I don't know if that's what she was mentioning, but do you know of any plans on that, or how is that working for those folks that are speaking Spanish in customer service?
I know that they are working on onboarding more Spanish speaking customer service agents for our members, but not only that, for those agents that speak Spanish and want help as an agent with our producer help desk, they're working on that as well. I know that right now it's in the piloting phases, but they will be rolling it out across the country. So more to come on that. Hopefully, if we have more information, we can share it during our 2024 rollout. But just know it's in the works, and we'll definitely keep you posted on that.
Got it. You mentioned that the certification for United actually comes out next week on June 12th, which
Yes.
from what we're understanding, AHIP does not come out until the 21st. So Mark is asking, some agents got an email that they were chosen for a fast track certification for 2024. He's asking, what does that mean? And can you talk more about that?
Yep. So there's a select agents that were chosen for that fast track program. And what that does is that instead of you having to go into our system and complete multiple certifications, it's just one certification that you're completing. And it's certifying you to sell all of our products, as well as to do events if you're an agent that works events. So it's kind of like a one and done, and there's certain requirements. You have to be selling, I believe, for over 2 years, not receive any complaints. So there's certain criteria that has to be met in order for you to be chosen. But I will tell you, I qualified for the fast track this year, and going in there and completing the certifications was so much less hassle, and it was so nice to just get everything done in one course.
Yeah, it's actually less confusing too, because we had agents that completed one certification but not another, and so they were locked out of certain plans. And so yeah, I agree. That's definitely, simplifying is the hardest thing to do. It sounds counterintuitive, but it really is. And so yeah, thank you guys for simplifying that for the
Yep.
agents for certification.
Absolutely. And just kind of wanted to share really quick, because of the certifications that we're talking about. Once you log into Jarvis, you can come up in here into the Knowledge Center. And then if you click on training and certifications, then that'll lead you to click on Learning Lab here, and it'll punch out into a separate window where you can go in and complete your certifications. Another thing that I wanted to point out, going back to the homepage here, is if you click on Knowledge Center and then go down into Product Overview, you can just click here where it says Final 2023 UHC Final Portfolio, and we know that there's agents that are licensed in multiple states. So you can come in here and search by every state. Once you click on the state, it does break it down by different regions. So in our case, we'll be North Central Florida. And the nice part about this is that you come in here and not only does it give you, and it should start from up here, but it gives you the market landscape by different areas and counties. And then it does give you the side-by-side comparison for all of these plans. So if you kind of want to download these sheets and save them to your desktop, you can. And it's just kind of a nice little reference point to have on there. I know that there's kind of I don't know why, maybe a little glitch in the system that you guys use or a miscommunication where it's not showing that our HMO plan has no referrals, but that's a huge deal. So, it is pointed out on here if it's something that you want to save and point out to your consumers, that you have it in writing right here. So you don't have to worry about it. I know some folks have mentioned, I get a little nervous because I don't see that information, but it's pointed out right here. And then some folks have asked us, well, why are some benefits in blue versus, this other shade of like navy blue? And it's just because it's highlighting the changes that took place for this year. So if it's in blue, it was a positive change that we had.
So on the training side, just to clarify, on June 12th, you guys will be releasing your training, which is before the AHIP is released. So am I right in saying that you can actually take your United Healthcare certification or recertification before the 2024 AHIP comes out?
That's correct. So with our company, you don't need the AHIP to sell UHC. If you complete our cert, then you can sell United.
Okay, so those that are taking the AHIP, do you recommend that they wait to complete the AHIP and then upload it into United? That way they avoid that additional certification. The ones that are fast track, we understand that's all in one, but some folks are not fast track. So
they can
do you recommend
wait
that they
if
wait?
they choose. Just overall, I always recommend, and I know it's hard because you guys represent multiple carriers, but I always tell everyone, try and get it done as soon as possible if you're going to be wanting to get that pre-order in, because then that'll make sure you get everything. Because especially this year, we're kind of limited. Susan and I last year kind of plugged in all around town, and we tried to meet folks and order a lot of materials. The problem with that is that they put a cap as to how much we can order. So when we have some available, we run out fairly quickly, and we want to make sure that everyone has as many materials as possible and that we're getting to everyone. So make sure to go in and place your orders this year. If you need any help on how to place it, then you can definitely reach out to us. But just to show you really quickly here, when you come into Jarvis, you can always click on sales and marketing. You come down into sales materials. And then under where it says sales materials portal, you would just hit order materials. And you can use the links that are on there, or on the filters on the side to narrow it down specifically to the areas that you're looking for. The nice thing about the sales materials portal is that as you start finding the different plans that you're accustomed to selling, there's a little heart icon on there that you can click on and save it to your favorites. So when you go in, you can just go straight to your favorites and place that reorder. I'm trying to get the page up and show you guys. There we go. It's a little slow, but so this is what the sales materials portal looks like. And if you can see here on the left-hand side, there is all these different filters that you can go in and just narrow it down. What I like to do, and there's materials in here in English and Spanish. What I like to do with this is, aside from hitting this little heart icon, is downloading also to your desktop. So they have like the summary of benefits, the evidence of coverage, all these things that if you're sitting with a consumer and they're asking you plan specific questions, you can always Control F and just kind of search for the keyword according to what they're asking. And then it's nice that you can search by the document type here, because it really helps you just narrow down your search specifically for what you're looking for.
This is awesome. And team, just so you know that on Shop, all of the United Healthcare necessary mandatory paperwork is already baked into your enrollment platform, and you can download it and send it to clients automatically. So, but it doesn't have everything that Jesse's showing you here. So, it is good to know where to order these things, especially if you're ordering physical kits, because this year moving forward, we will not be storing kits at Health Plan Markets for storage reasons. Obviously, we're building our new office, and storage is going to be an issue. So we very much highly recommend that you order your kits early and often, and make sure you have a nice spot in your garage or home office or home mobile office, i.e. your trunk of your car. Make sure you got what you need, because we will not be storing kits. We are going to shoot you back to the carrier to order kits. So that's just how it's got to be for now.
Yeah, and just
Awesome.
remember, there's also all sorts of tools on here. I know there's so many portals that you guys go into, but you can come in here and do Medicare, Medicaid verification. So there's all sorts of different goodies in Jarvis to help make your lives a whole lot easier.
Question from Flor Delisa. Hey, Flor, how are you? Is the coverage for worldwide, is it just for urgent care and ER?
Yes, it's just for urgent
Yes.
care and
Okay.
ER.
Perfect. Another question, no limit on MA plans only. MedSup's different for worldwide coverage. I know you're on the Medicare Advantage side, and guys, tune in next week. By the way, we're going to have the United Healthcare will be here back again for the supplement. So Medicare supplements, we're going to have all the questions for next week. But do you know the answer to that as far as the subs go?
I don't, but can I phone a friend? I do see Al Clancy
Yeah.
in the meeting here. Maybe Al can chime in and let us know.
Yeah, feel free, Al, if you know the answer to that. So just remember, Medicare specifically is still your primary on a supplement. So Medicare does not have worldwide coverage. We do know that. It's only available in the States and in US territories. But certain Medicare or certain supplements do have worldwide coverage. I can't answer that, but it depends on what plan you're enrolling in. So, Plan F is no more. You've got Plan K, you've got Plan G or whatever's going on over there. So just keep in mind that I think I'm going to say that it depends on the plan. So just pay attention to that. Luis says, great UHC DSNP benefits regarding the dental network. Could UHC clarify on the U card that AARP includes the PPO dental network, not just with dental? I guess that's
Okay.
feedback for you.
Yeah, absolutely. So, I mean, we're passing along as much information and feedback as we get to make sure that we can make it as clear as possible. Right now, it's more of an education piece with our providers that we're working on. But yeah, it is confusing because, like you said, if the plan is an HMO, but the dental benefits are a PPO, then I can see where that confusion comes in. We just try and educate our members and providers as much as possible. And if there's a provider's office that you feel needs specific kind of clarification or education on that, then definitely shoot us an email and we can pass along that information so that they can reach out to that provider's office if they're in our network and they're not understanding that or whatever the case may be. We can definitely make sure that they get the information that they need to service our members.
Awesome. And Susan's in there. She says no extra steps if you certify early. Fast Track only has 38 questions. I love that.
Yes, it does. It is awesome, guys.
Yeah, we love it. Now, guys, it's certification season. We're back at it. Can you believe it? It's another plan year already. We're getting ready for 2024. Hallelujah, right? This is just amazing. This is my 20th season being in the business. So yikes, I'm showing my age now. But what's exciting is, yes, we have more plan options than ever before, but things are getting easier. Things are getting more streamlined. We're becoming better, faster, stronger. So although you take these certifications, I know that you may still have a lot of questions. Please do not hesitate to reach out to Jesse or Susan regarding any questions you have for United specifically, or us. We have an entire team, and my team's on the call this morning. So thank you, Nick. Thank you, Sam. Thank you, Al. Thank you, Kim, Jessica, Cindy. I see you guys on there. I'm sure we have some more folks on there too, but we are here to help you and ensure that you are getting the right information so you can make an enrollment for your client and keep them healthy, happy, and safe. And you get paid doing it. Isn't that awesome? So we really appreciate that. I know we went over time. Special thank you to Susan and Jesse for sticking around for a longer than normal session. You guys just have such great information. United Healthcare is very important to health plan markets, so we appreciate your participation. And we really appreciate all of you guys for sticking around to the end of the call. You got it first, you got it early, and we are here at the end of the call. So thank you guys. We will see you next week. Thank you all. We appreciate you. Thank you, Susan. Thank you, Jesse. We will catch you on the flip side. Thank you guys very much. Have a fantastic and productive first week of June. Take care.